Today I'm joined by my childhood friend, Julie Medwid, who is a physiotherapist living and working in southern rural Manitoba. And she has a bachelor's degree in kinesiology and a master's in physiotherapy. And she's pursued additional training in pelvic floor physiotherapy, where she has the opportunity to dive in a little bit more today about how she helps people, whether they're working on helping their incontinence, pelvic pain, pelvic organ prolapse, pregnancy, postpartum, any of those concerns that she's already dealt with, we kind of dive into a bit here today. And she's not just a physiotherapist, she's also a mom of two. So that makes her a consumer of all things pelvic floor health for herself. So she knows firsthand how pregnancy, postpartum, and day-to-day realities of being a woman can impact pelvic health. And, she doesn't just have that lived in experience. She has the educated knowledge to bring a really solid message forward, and for women to start to feel more confident in the ways that they can start to pay attention more to their health and speak up to the people that they need to lean on for support, to say, hey, I need to focus on this, as my health I feel like I'm figuring things out and needing to see what the cause of these things are, because women's health has kind of been pushed to the side. So we dive into that a little bit more. And just before we dive in, a quick reminder that this is a conversation for educational and entertainment purposes only, and it shouldn't be taken as medical advice. And I want you to please consult a qualified healthcare provider if you do have some specific health concerns. Okay, so let's go chat with Julie and learn a little bit more about pelvic health. Okay, welcome, Julie Medwid. So happy to have you here. Childhood friend, what a full circle moment to have you here with me today. We're going to talk about some stuff that women need to hear. So thanks for being here today. And let's jump into kind of how did you get into physiotherapy, kinesiology, and then how did you kind of morph into that pelvic health specific area of focus?
Yeah. So thanks for having me. This is really exciting. I am a huge consumer of podcasts. So, um, yeah, the fact that you have your own now is just incredible. So, yay, happy to be here with
Yay.
you.
Yeah. Yes.
So yes, I'm a physiotherapist. As you have learned kind of in my bio, that I took my first degree in exercise science in kinesiology, and further pursued my master's in physiotherapy. I have always been an exercise nerd. Danielle and I used to wake up at 5 o'clock in the morning to attend our high school gym class at 5:30.
Yeah.
And we used to run laps around the track. We used to do weightlifting together, and that was good times.
Yeah. And crazy to think of how long ago that was. I'm like, oh my gosh, it feels like yesterday, but oh man.
That's a while. Yeah. We won't say.
Yeah. Exactly.
We won't say how long.
Yeah.
And so I was a gym goer, and that shaped my love for exercise. I wasn't a huge sport person, so I didn't do organized sports. I danced. But the gym really, I loved, the programming, how strong my body felt, and the benefits. And so when I was thinking of a career, I was thinking, okay, how can exercise meet the medical world? And I love coaching, or I taught dance at the time. I like that one-on-one, and that's what made me think of physiotherapy. And I worked my butt off in university.
Yeah.
Sometimes I wish I had a little more chill, but here I am.
Yeah.
I got into physiotherapy, which was just this huge dream of mine. And when I graduated from physiotherapy, I moved out to a small town, and where my boyfriend, now husband, is. And I'm a rural physiotherapist. I commuted a lot for work.
Yeah.
in the earlier days, and that led me to like doing a ton of the continued education on podcasts. And I found my way to like the pelvic health world through these podcasts. Um, and yeah, it was just really, kind of opened my eyes into like the whole person approach to physiotherapy that, the 60-year-old woman that comes into my clinic for low back pain. Um, in school I didn't have that pelvic health piece, the pelvic floor muscles we didn't even learn about.
Yeah.
Um,
That's crazy
wild.
though. Like,
And that's like in perspective. I spent a whole degree in kinesiology, learning like anatomy, physiology, biomechanics, and a master's in physiotherapy. And like we did not talk about the pelvic floor.
that's
Like,
nuts. Like women's health, like who, like what
yeah.
is it? Like that's
And
like
literally
recent. Yeah.
everyone has a pelvic, like everyone has a pelvic, every
Yeah.
single person,
Yeah.
male, female, everyone. Like, so I just, anyways, so that just really opened my eyes into like the whole person approach to physiotherapy. How can I treat the mom of two that is 2 years postpartum, who injured their ankle because they were trying to become more active? Finally found the time and energy to become more active.
Mm-hmm.
Um, why am I not addressing those pieces, and how public health fits in? So
Mm-hmm.
um, yeah, so that just really opened my eyes and to the public health world, and I was like, yeah, absolutely, anything to keep people living like full, active lives that are meaningful, and public health related conditions, um, and pelvic floor dysfunction are so limiting to people. It affects their quality of life, their participation in physical activity and exercise, their confidence and safety in their body. It's just, it's so encompassing. And so we need professionals to, yeah, to not
Yeah.
be afraid of the pelvic floor.
Yeah. And it's like, I feel like I'm even hearing more about it. And maybe it's just because I'm like, yeah, putting my ear to it a little bit more now. But like, why do you feel like now it's starting to get more attention? Do you feel like it's starting to be built into more of like the education piece, or is it still kind of that slow moving piece that we're just starting to pay attention to?
Yeah, you know what, I don't know what lit that spark. Like, it's, like, I just feel like there was like this build, and like the practice of pelvic floor physiotherapy has been happening for, I don't know, like 50 years or so. But just in the last like 10 years, doctors have been prescribing, referring their patients to pelvic floor physio. We don't have, like in Manitoba, um, as of right now, we don't have any standard postpartum care for pelvic floor rehab. As much as, in the background, this has been happening, we're just now starting to see change. And part of that could be development of research. It takes a long time for research to come into practice. Government systems like, so the Canadian Physio Association, we're starting to see more advocacy work and conversations happening at a government level about funding for pelvic health programs. Um, and I think people are just fed up, like
Hmm.
women are frustrated,
Yeah.
you know,
Yeah.
and, part of it is just being loud from the ground floor, and then
Hmm.
then the system catches on.
Yeah.
Um, and so it's it's important that it's out there, right? That we're being loud about it. What's super important is that we're being loud about the, um, getting the right information.
Hmm. Yeah. Yeah. Not just any, because like from what I even see on social media, because like that's my only experience with it so far in terms of like education piece, like quote unquote education.
Yes.
Like, do you find that like clients even come to you like already kind of with like a preconceived notion of like what they need to fix with their pelvic floor, or like how to, like the self-diagnosis is like louder than ever, but like I mean that means they're excited and interested in figuring out what's going on, but like do you feel like that's happening more so now that it's kind of out there?
Yes. Yeah, absolutely. And I support the Google, I want people to Google or chat GPT their symptoms. Like
Yeah.
I want them to actively search.
Hmm.
Um, like I welcome that. But when they come into the clinic, I want to hear what their expectations are, what their beliefs are about what they're experiencing, because what's consumed through social media or what's provided to them may not be actually the case for them specifically.
Hmm.
So, a common example is, I'll have someone come to the clinic and they have urinary incontinence and they're like, oh, I know my pelvic floor is just so weak. And
Mm.
that's why I'm experiencing, I'm just so weak. And then we do the assessment and thorough history. And it turns out, no, like they actually have great strength. They just, maybe the coordination is a bit off, or, um, they have a condition called like urge urinary incontinence, which sometimes coincides with that overactivity of the pelvic floor. Not that they're weak for that; they're just not maybe using their muscle system
Hmm.
in the most optimal way, and then they're
Yeah.
getting symptoms.
Right.
Um, some people, are doing almost like so much, like they're, well, I tried this program and then like a week or two later they switch to a different program or a
Yeah.
different approach, like instead of just sticking. And I think this could resonate with you and your approach to things,
Yeah.
Danielle, is um consistency is typically when you're going to get your results. Like
Hmm.
instead of jumping from one thing to the next to the next to the next,
Yeah.
like maybe if you just stuck with that first thing for a while,
Hmm.
right?
Yeah. Totally.
Then you're more likely to experience a benefit. So
Yeah.
yeah, like in the day and age of there's so much information out there, and again, it's great. People are talking about there's lots of information out there. It could also leave people feeling like, either deduce their condition just to like one certain thing, like,
Right.
oh well, it's like only this thing, or only these three exercises are going to cure my pelvic floor dysfunction.
Yeah.
Um, there's just more personal, patient-centered approach to it instead of kind of a catch-all.
Right. Yeah, because it's not a one size fits all, because
Mm.
it's impossible for that to happen, right? Like there's a lot
We're
of
human.
yeah, there's a lot of like similarities between things, but to say that like the way that you're having a symptom is exactly the way that someone else is experiencing a symptom, and the cause of it is the same, is like, okay, well, that needs to be explored with a professional, like not just,
Yes.
and like you said, it's so good that there's so much information out there, but being able to bring it to someone to say like, hey, like I am doing all of these things, or I've learned all of these things, but like I'm still facing this symptom. It's like, how can I face this? And yeah, the consistency piece is huge, right? It's to say, okay, well, how
Yeah.
long have you been doing that? And like, how, what else have you tried? And it's like, oh, I've tried this, and this. It's like, okay, how long have you tried everything? Oh, a week. And it's like, okay. Like, and then being able to peel back the layers and say, okay, you know, especially with like an assessment and like really being able to see the baseline and have that your backing and say, hey, like this is what I'm seeing. I love that you're bringing this to me. So now we can pair it together and like make a
Yes.
plan together. So like,
Yeah.
what is the one thing that you feel like is like the most, I don't want to say like hyped up thing with pelvic floor health, but like kind of like the most, maybe it's overrated, or maybe it's the most misunderstood thing about pelvic floor health, or like how to approach it? Like, is there anything that always comes to you and it's like, okay, this is has to get rephrased or reworked in terms of the way it's being presented?
I'm going to speak to something that's a little bit uh, more recent, kind of related to kind of the stage of life I'm in,
Hmm.
um, personally. But just because I'm also a consumer of pelvic health information, right? So like, so I'm 5 months postpartum now, and with my second, and with my first, I had a C-section. my second, I plan to have a trial of labor. The term is TOLAC. After trial of labor after cesarean, and you know, okay. So what the research shows. Okay, so if women are active in the pregnancy, there's both maternal and fetal benefits to that. And so typically, activity is good as long as you don't have any what are called contraindications to exercise. Well, pregnant, okay? Um, so, you know, but some of the content out there is saying, okay, well, if you do this program or if you're active in this way, you're going to have an intervention free birth, if that's what someone desires, right?
Right.
And I know, and we can't promise people that.
Yeah. Yeah.
Even if the research shows that, if you do this, you are less likely to experience complications in birth and delivery, or you're less likely to experience gestational diabetes. Um, if you do your perineal stretches, which is is the way to, well, yeah, it's a way to kind of help prepare the perineum for childbirth, both physically and neurologically. There's mechanisms of why that can be helpful, but and in a possible strategy to decrease perineal tearing during childbirth. But doing that does not guarantee you're not going to tear, right? Like,
Yeah.
so it's just important. Like, there's a lot of information out there, and that brings a lot of hope, which is great.
Yeah.
Like pushing the pushing stage of labor, not pushing on your back, can be protective to your pelvic floor, and decreasing risk of perineal tearing. But sometimes that's outside of your control, and you're going to have to push on your back,
Yeah. Yeah.
right? Like, or being active in your labor, or like there's just so there's so much advocacy, and which is really good. We want women to have the tools and the talking points to advocate for themselves, but all this information should not be used as a blueprint of, okay, if I do check A, B, C, I am going to have this outcome.
Right.
Because when it comes to pregnancy, birth, and delivery, postpartum, there are too many factors to be able to control that precisely.
Yeah. Yeah, and the individualism of it all, like everyone's so different and how their body responds. Like you could have, 100 women. If you did the exact same thing for every single woman, there's still going to be a different result for every, like you might see patterns, but and yeah, it's the one thing that kind of came to mind when you were talking about that is the like when I think of pelvic floor, like, I think a lot of women even think of like, oh, postpartum, but it's like so much more than that. Like someone who will never have kids, or someone who is not wanting kids, or someone who is just in the beginning stages of, getting pregnant, or like it sounds like it's so much more than just like, okay, once I have an issue, then I could pay attention to it. Do you find that there's people coming to you like even like not preventative, I don't know if, like, I guess proactively, is there that starting to happen too?
Yeah, absolutely. Like we see, um, oh gosh, okay, so there's outside of the perinatal world, we could have people experience like pelvic pain, with any type of penetration. So that could be with using tampons, using anything inserting, any pelvic exams, the speculum. It's just so painful for them. Intercourse, all of that can be. Um, there's more information out there now about like it's not normal, and there's help for that.
Mm-hmm.
Some people have pelvic health related conditions, like pain conditions like endometriosis. Um, there interstitial cystitis, there's
All the
and
fancy words.
there's all these things
Yeah.
that can cause uh, that overactivity of the pelvic floor or pelvic related pain can coincide.
Mm-hmm.
So as a pelvic floor physio, we don't, I'm not, by no means, I am not curing endometriosis or
Yeah.
treating
Yeah.
the condition itself, but the secondary things that come from that,
Mm-hmm.
like the pelvic pain. Yeah, so people are, becoming more aware. They're even just like questioning some things like, okay, I'm thinking of becoming pregnant. What are some I want to know what my baseline pelvic floor strength is, or
Mm-hmm.
hey, whenever I do like this snatch, with a barbell, I leak a little. Like, what's that about? I've never had kids.
Yeah.
Um, like that's all things that pelvic health, yeah, addresses.
Yeah.
And I do see content in talking about that, which is really good.
Yeah, amazing. And like, and even like it feels like it comes down to, and I know you said like like everyone has a pelvic floor, so like men included, I'm assuming. But I
Mhm.
mean, I'm more interested in women's health because I feel like we talk about a men's health enough. So like we could talk
Yeah,
about women's health
yeah.
here. Like, sorry, men,
Yes,
there's another
yes,
podcast for
yeah,
you. Um, but
yeah.
but like even for women, I feel like because women's health and like women's like in terms of how we approach our health and with strength and things like that, like especially with kind of going back to like the social media piece and how sometimes we compare like other people's experiences and our own, and like the diagnosis part can come from it, but also like the like, oh, that person did this, so like why isn't it happening for me? I feel like that comes up a
Mhm.
lot too, like within physio or pelvic health. It's like, how can we start to shift away from comparing ourselves to others, and focusing on like, okay, what am I experiencing, what can I do to help my own strength, right? And like, what do you feel like you've done with the clients that you've, or the patients that you've worked with, like what do you feel like you've seen a huge shift in terms of helping women just regain strength again in their bodies?
I think that there's a huge education, and yeah, this is like kind of a full circle moment talking about how it's important that the information that we are putting out there in women's health is not that it's accurate and it's not misleading.
Mm-hmm.
Because some people, can be super active in their pregnancy. They could have a beautiful, quote unquote, perfect birth and delivery. The way
Mm-hmm.
that they see it is perfect for
Mm-hmm.
them. And their return to exercise postpartum is excellent, and they're as active as they want to be throughout their life cycle. And great, that's great for them.
Mm-hmm.
And often that's portrayed on social media, is this like the highlight reels.
Yeah.
But in reality, life fluctuates,
Mm-hmm.
right? So whether you're pursuing a degree or getting started in your career or planning to have kids or currently pregnant, just had a baby, your body's shifting hormones during perimenopause and it's wild out there.
Yeah.
And then you're postmenopause and things just feel different, or you have a health condition. I see patients in all these realms,
Mm-hmm.
and it's really important that they feel like their care plan is specific to them, that someone else's journey, what they portray, or their neighbor next door, it's it doesn't mean that their journey's wrong.
Yeah.
Does that make
Yep.
sense? If it doesn't
Totally.
look like someone else's,
Yep.
and it's okay to be inspired by others and be like, hey, I'd love to
Yeah.
be there. But if you're not there yet, that doesn't mean you're not making progress. It doesn't mean that, or it may mean that some people, they need to focus more on strengthening.
Mm-hmm.
Some people are just like almost trying to do too much that they're overwhelming their system.
Yeah. Yep.
Like, let's like take some burden away. Like,
Yeah.
again, so I maybe because I'm fresh postpartum. I'm going to speak to this, that like, uh, I, I wish that I was in a situation right now where every day, I wish I was going to the gym and working out every day and pumping my muscles and feeling like, uh, the reality is I have two kids. I, I prioritize my sleep because I know better now.
Yeah. Yes.
Like the sleep I can get, I do the things that are life giving and the ways that kind of spark joy in my life. And sometimes that's going to be not forcing myself to go to the gym every day because
Yeah.
at this point in my life, even though there was a time I really enjoyed that,
Yeah.
it's going to stress me out.
Yeah. Totally.
And I'm
Right.
right. And I'm going
Yeah.
to be cutting on my sleep and I'm going to be trying to find childcare in order to get to the gym. Like,
Mm-hmm.
can I instead work out at home or, fit in 10 minutes here or there, or like I did the other day, answer my emails while I'm on the exercise bike?
Yeah. Yeah.
Um, is that wrong? No. Is this my journey right now? Yes.
Yeah.
Uh, and I think more people, like the more we talk about the, um, let's be real, right? Like
Yeah.
about the human experience, that and all the power to the people that works for them postpartum. They have, to them, going to the gym is brings them life.
Mm-hmm.
Great, that's all. I want that for them.
Yeah.
But not doing anything or not having anything that brings your body recovery and feeling good, and whatever that looks like,
Mm-hmm.
um, regaining that function back postpartum, like it doesn't have to look like this only one way, you know?
Totally. Yeah. And like it's so good that you're pointing that out because like that's something that I've even learned just as someone who yeah, has gone to the gym and like I've pushed it a little too hard and then I had to realize like okay, at this stage of my life when I'm trying to like focus on my business, focus on my life with my boyfriend and my family, like all of these things that I'm trying to accomplish all at once and then I'm trying to push my body into like these crazy workouts and like trying to do handstand push-ups and then all of a sudden my neck is completely flared up and I can't work out for 2 months. It's like there could have been some solution there to like pull back a little sooner, right? And like
Yeah.
the the drive shouldn't like the drive to like get stronger and to like move our bodies should be for it to match the season that we're in, not necessarily to like
Mm,
make force the thing that we've always done into every season of life because it's just not realistic, right? Like it's not realistic for you to go to
no.
the gym every day. Like what is that going to do to you? And like is that what we like what do we truly want and how
Yes.
can we like add like pieces in versus being like
Yes.
here's a big old chunk and just throw it at it, and it's like that's going to be really hard to manage, right? So I love that you're even like pulling that in, and especially for new moms, like that the life before versus the life now, it is different and that's okay,
Yeah.
right?
It
And
is
I love that.
okay. I I think when you give people permission to just respect their own journey,
Hmm.
it takes a huge burden off their shoulders, because then it's like, oh, okay, you mean it doesn't have to be that complex. Like,
Yeah.
I recently took a course, and the Susan Clinton, who's a very profound pelvic floor physio educator, and uh, she said, "Small hinges swing big doors," and it's quite literally, okay. You don't have to have this perfectly curated plan, but if we implement, little things
Yeah.
in the context of that person and stick with it,
Hmm.
there's a good chance you're going to feel good in your body and you're going to
Yeah.
recover.
Yeah.
Um, it just may not happen in the 6 week time frame, or I. Yeah, I'm maybe going around here.
That's okay. Let's hear it.
Okay.
This is what it's for. Yeah.
Okay. So postpartum, we have like this return to exercise typically what happens is, okay, you have a baby, and whether it's 6 weeks or 8 weeks later, you get your appointment to get yourself checked over afterwards by your doctor, nurse practitioner, whoever you see, and you get the check clear for exercise.
Mm.
However, there's a whole 6 to 8 weeks before that
Yeah.
that like your body has gone through the biggest shift physically, hormonally, and like even like your identity, everything has shifted in this
Mm-hmm.
time period. And then all of a sudden you get cleared to exercise without much, like where's the rehab beforehand, right?
Yeah.
What was happening during those 6 weeks? And
Mm-hmm.
so then we see like, returning to, like some people are returning to running, because they were clear to exercise, or,
Mm-hmm.
weightlifting. And then, another 2 3 months later or a year later, they come into the clinic and they're like, hey, like I'm experiencing a lot of heaviness and pressure, kind of these prolapse symptoms,
Mm.
or I have a lot of like low back pain ever since I had my baby.
Mm.
And they had a C-section, maybe didn't do a great core rehab program,
Yeah.
or the focus wasn't on core rehab. It was about, and again, our worlds are going to cross over here,
Yeah.
that like desire for weight loss and bounce back
Yeah.
culture
Yeah.
is still present,
Mm-hmm.
and especially preying on the postpartum world. And I again, from an injury risk perspective, if we ignore our own body cues and push our body to what we think it should do versus that that assessment of, am I capable of this? Is it the right time? Is this type of exercise serving me?
Mm-hmm.
Am I ready for it?
Yeah.
Right? Did I do the stuff beforehand to build up to this moment?
Yeah.
Um, instead of, oh well, I gotta fit into this dress in 6 months, so I'm gonna push myself at the gym no matter what, right?
Totally. Yeah.
So, anyways,
No, it's
I think
so
I lost my train of thought, but
no, it's so on, like I'm following you 100% because it's not about how quickly you can get back to what you were doing. It's like your body has been through this drastic change in every single way possible. And like for some people it's not as drastic. It's like there's such a scale on how much change you're experiencing,
yeah,
right?
yes,
So it's like, okay, how do we just give a check mark, like a yes no tick to say like yes you are good to go or no? It's like, okay, but like what are the
yeah,
variables in between to say like, okay, yes for weightlifting, yes
what,
for
yeah,
running, yes for just like doing a sit up, like
what
what?
type of exercise? How much? What
Yeah.
like are even like so cardiovascular exercise? The you can again. So this is the caveat of individual assessment first, but
Yes.
there are guidelines out there, through the Canadian Society for Exercise Physiology, CSEP, for exercise guidelines postpartum. And cardiovascular exercise can be done prior to 6 weeks,
Mm-hmm.
because it's important to for maternal mental health. It's important for physiology, for recovery and healing, for circulation. Um, Now, does that mean you're ready to go for a run, 3 weeks postpartum? No, like it would be very, 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 very small. Yeah, I
Percentage.
don't,
Yeah.
y- yeah, I don't
Yeah.
even know a situation where that would be cleared.
Yeah.
Um, but could you sit on an exercise bike? Maybe, right?
Mm-hmm.
So that was something that I chose to do earlier on, was just because I needed to move my body,
Mm-hmm.
right? But I sat on a nice wide seat, stationary bike, put on some fun music. Sometimes I was wearing my baby at the same
Yeah.
time.
Amazing.
And just paddling, getting my heart rate up, and my mind felt better for it. My, sleep is better for it.
Hmm.
So again, it's that nuance of, and here's where I'm going to speak to a professional who's trained in pelvic and reproductive health in the world of exercise and physiotherapy specifically, is we can work with that patient to guide that,
Hmm.
that, are you ready for this? And what are some signs that your body is ready for this versus not? What are some signs that your body's telling you to back off, to stop, to slow down?
Yeah. Yeah.
Um, and
It's
when's the
a,
time to progress?
yeah. And it's almost like what I'm hearing is like a lot more, there needs to be a lot more attention paid to, like, we need to pay a little bit more attention to like women need to be paid attention to essentially, right? Like their health.
Yes, yes.
And it's like if someone is, going through their pregnancy and they're like, okay, like I guess an important thing in my mind, like say I was like, I want to get pregnant right now. And my first thing would be like, I'm going to go find a pelvic floor, like physio. And like, I'm going to make sure that like from beginning to end and after, I know what my body's going through. I know how to handle the next step. Like it blows my mind that like every pregnant woman isn't given like resources to say, "Hey, here's some local physiotherapist or here's someone with like pelvic health." Like it's kind of crazy that that's not happening at all because women
Yeah.
have been giving birth for ever. So
Ever.
like why has this never been so like in my mind
Yes.
if like my view on it is like if you're, you know, actively trying to get pregnant or are pregnant or really like post maybe you just had a baby, like find someone if especially if you're like curious about like what do I do now? Like and you're
Hmm.
just like it's great to lean on your doctor, but there's a lot of resources to lean on as well. Not saying like every single pregnant woman needs a physio, but like it would be so
Yeah.
helpful for your body because it is going through so much and like if especially if it's your first, like your body's never navigated that before. Like you've never experienced it before. So why not have a little extra support? And then maybe if you go through it again, then you're like, oh, like this feels very similar. Or maybe it's like, I guarantee that I need to have someone there with me to like assess my pelvic floor and to assess what my
Right.
body's going through because it might be different this time, right? Like,
Yeah.
so me just saying, like, even I'm like, okay, like that seems to be the thing that like every woman needs is like that's their like pairing of like you need to have someone to support you through all of
Yeah.
that,
And
especially.
the fetal assessments are so important, and that's what like the doctors are really great at doing, right? Of course, like monitoring, make sure baby's growing, and you're
Hmm.
measuring good, and then the maternal health things like testing for gestational diabetes, checking blood pressure, making sure preeclampsia isn't occurring, and assessing mental health, which I mean, being aware of maternal mental health and postpartum mental health is everyone's business.
Yeah.
To know the warning signs. Yeah, I do think that prehab, if you will, right?
Yeah.
And we know this. So we know this with um, knee replacements. Okay, so
Hmm.
when someone gets their total knee replacement, um, if they do the work beforehand, to get the education, they know what are the possibilities of what's going to happen. They know what tools are going to be helpful for them
Hmm.
afterwards. And they get that all prepared and they do their exercises, they get as strong as possible beforehand. We know in research that their outcomes are better. They return to the activities they love to do sooner than someone who doesn't do that.
Hmm.
So again, so women's health, we have people that are, yeah, like having babies and they're not getting that preparation of, okay, here's here's how to navigate. Again, we know exercise is healthy during pregnancy.
Yeah.
How do we navigate that when you're super nauseous, when you have maybe other kids to take care of. You're working full time.
Mm-hmm.
You, maybe have other things going on, pelvic girdle pain,
Mm-hmm.
all of those things can, when you have a professional to work alongside with, you have that voice of reason to help navigate. And then, I mean, our role as physiotherapists partially is to be an advocate and a collaborator, meaning
Yeah.
that it's our job if there's something that someone needs outside of my scope of practice, then it's my due diligence to make sure that I communicate to that provider, given my patient consent,
Yeah.
to get that help, right? So and so's experiencing um, you know, these symptoms, would you see that, a further assessment would be indicated?
Mm-hmm.
And again, like how do people know
Yeah.
to get that
Right.
help if they don't have that person to help guide them?
Yeah.
And like in this, um, currently, like I sit on the board for a volunteer group through the Canadian Physio Association for Pelvic and Reproductive Health. And part of the reason why I joined this volunteer group is I'd love to be some sort of change at some point in time to advocate for, um, this to be standard practice, right?
Yeah.
That people get care. Like someone that has a total hysterectomy, that they have a pathway
Yeah.
and the care they need, both pre-education, immediately post-op, assessment, and then your recovery plan, and that
Yeah.
it's part of their healthcare system.
Yeah.
We're lucky in many ways in Canada to have healthcare covered, but
Yeah.
some of these things, if we can prevent, and we know, so this is
Mm-hmm.
what I get really excited about. We have grade A evidence, level one, grade A, to support pelvic floor muscle training, which is, Kegels.
Yeah.
Okay, there's
Yeah.
nuance to that.
Yeah.
Um, to both treat and prevent urinary incontinence and prolapse symptoms from the prolapse grades 1 to 3.
Mm-hmm.
That is significant, like that we have strong enough research. So that level of research means that there's enough high quality studies to compile this level of research.
Yeah.
That's exciting, right?
Yeah.
But here we have this research and we have no programs in place, or in its
Yeah.
infancy, there are programs. Some places in Canada where we're starting to see this happen, and these
Mm-hmm.
programs in place.
Yeah.
So yeah, I mean, women keep being loud, keep
Yeah. Yeah.
asking the questions and
Mm-hmm.
consuming the information, but also questioning. You know, um, yeah, seeking the professional help, like, is really important to help guide you
Mm-hmm.
in that information. It's really important.
Amazing. I think that's like such a good way to, leave people off for just like to have that piece of hope to say like, okay, like what can I do next? It's like, yeah, seek out someone. Go do a Google search of like people around you, or like try to find that resource, because yeah,
Mhm.
it's slowly being built up, but at this point we do have to dig a little bit, but it's there. And the
Mhm.
more that you're curious, the more answers you're going to get with those people that are going to help guide you. So I honestly, I appreciate you sharing so much of this, because like I'm like, man, like we could dig so much deeper into like more things like women's health, right? Like, man,
Oh,
come
there's
on.
so much, there's there's so much,
Mm-hmm.
it can be an overwhelming space, and I am by
Mm-hmm.
no means someone who, I don't know it all by any means. I
You know a
am,
lot.
you
Yeah.
know, I know what I know, and I'm continually learning. And another 10 years from now, I'm sure there's things that I practice now that no longer will be common practice. That other
Mm-hmm.
things are better, and new technologies coming out, and things like, it's exciting.
Mm-hmm.
Um, but there's just there's so much. And it can feel like an overwhelming space for women, I think. at times, and so yeah, just really important to be seen. It's
Yeah.
really important to talk about stuff like this,
Yeah.
and know that you're not alone and there's help out there.
Cool. I love it. Well, thanks so much, Julie, for being on the podcast today. It's been so amazing to
Yeah.
just hear your knowledge and share it. So thanks so much for being here. It means so much.
Yeah. Thank you.
Well, I hope you enjoyed this conversation as much as I enjoyed having it with Julie. And I just love how she brings not only her professional expertise, but also her personal experience as a mom into the discussion about how important it is to focus on pelvic floor health and how it looks different for everyone, right? Like that's so important, whether you're pregnant, postpartum, or just navigating everyday life, that comparing your journey to someone else's just isn't helpful, right? So, if you'd love to connect with Julie and learn more about her work or ask her some questions, you can find her on Instagram at Julie Medwid or at juliemedwidphysio.com. So, thanks again for listening and for tuning in to Let's Get Real with Danny. We'll see you in the next one.